CHADD is 25, and we are making a difference. What is CHADD? We are an organization dedicated to improving the lives of millions of Americans affected by ADHD. CHADD was founded in Florida in 1987. Fran Gilman, Carol Lerner, and Dr. Harvey Parker hosted a meeting to address the problems of a private school student with ADHD. Within weeks, CHADD was an incorporated, nonprofit organization, and local CHADD meetings began springing up in Florida and around the country. From that first meeting in Florida, CHADD has grown into the nation's premier advocacy and support association for people with ADHD. We disseminate scientifically based information on all aspects of ADHD to parents, affected adults, teachers, clinicians, and anyone else concerned about this disorder. We offer support through a network of passionate volunteers, members, and staff. We partner with the nation's leading clinicians and researchers to keep in touch with the latest treatments. And we influence national legislation concerning ADHD through our work in public policy. This year, CHADD celebrates its 25th anniversary with an impressive record of progress that remains true to its local community grassroots. Our 25 years of making a difference has led to many accomplishments. In 1989, CHADD successfully launched a massive campaign to include ADHD in the Individuals with Disabilities Education Act, or IDEA, the national special education law. In 1993, CHADD expanded its vision and its name to include adults. In 1994, CHADD introduced Attention, our award-winning magazine. In 1995, we launched the CHADD website with a wealth of information on ADHD. In 1998, CHADD moved its national offices to the nation's capital to better advocate for the ADHD community and to combat the spread of mental health misinformation. In 2002, the Center for Disease Control awarded CHADD a grant for the development of the National Resource Center on ADHD, now in its 10th year of making a difference. In 2003, the CHADD National ADHD Education Initiative was launched, providing policymakers, the media, and the public with science-based information on ADHD. The goal? Reducing stigma and promoting the awareness that ADHD is real. This was followed in 2006 with the publication of the Educator's Manual on ADHD, which was distributed to every public school in America. In 2007, our Parent-to-Parent training program was launched, teaching parents how to manage their children's ADHD more effectively. Parent-to-Parent has provided more than 6,000 families with tools to deal with home and school issues. In 2008, CHADD began Teacher to Teacher, an educators in-service training program. This program gives teachers the skills and knowledge they need to support and manage students with ADHD. In recent years, CHADD continued to make public policy inroads. We participated in congressional briefings on ADHD. We helped block congressional attempts to remove ADHD as a Social Security disability. And today, we are fighting to eliminate current drug shortages and prevent them from occurring in the future. And for the 24th consecutive year, the CHADD Annual Conference is the premier educational forum on ADHD, bringing together the leading researchers and practitioners. As impressive as CHADD's record has been, we have much more to accomplish. By 2015, CHADD will support 15 million people affected by ADHD by meeting the following goals. CHADD will provide access to information and support for every child, teen, and adult diagnosed with ADHD. Support that comes from our National Resource Center. from a newly expanded and more user-friendly CHADD website, from an expanded parent-to-parent program, and from our local support groups across the country. In all of its programs, CHADD will become more responsive to the diverse nature of our membership. We will address the unique experiences of various age and ethnic groups. The National Resource Center will provide complete access to its resources in Spanish. And by partnering with Latino organizations across the country, CHADD will provide parent-to-parent training in Spanish. CHADD wants to be the ADHD resource for every teacher in America. Our Teacher-to-Teacher program will be offered to school systems across the country, available online to any teacher. And the CHADD online community for teachers will provide valuable information on classroom management and support of ADHD students. Teens and adults with ADHD are far more likely to smoke and have far more difficulty quitting. CHADD will coordinate information on the connection between ADHD and smoking and disseminate best practices for treating smokers with ADHD. CHADD will enhance our information on co-occurring disorders, such as anxiety, learning disabilities, substance abuse, and depression, since ADHD often occurs with other related disorders. CHADD will continue to intensify its public policy advocacy. We will continue to fight for you every day on a variety of issues, eliminating insurance discrimination, protecting your civil rights for reasonable accommodation in the workplace, as well as in the school setting. And we will continue to fight to ensure that drug shortages of ADHD medications never occur again. Our efforts will be heard throughout the halls of Congress and the federal government. We have come a long way, and we have made a great deal of difference, but there is much left to do. As our goals indicate, there are many challenges to be faced and victories to be won in the years ahead. CHADD relies on its members, friends, and other stakeholders to support the wide spectrum of CHADD programs and services. Your gift can create a beacon of hope for individuals and families facing the realities of ADHD in their lives. Please help CHADD move forward into the next quarter century by making a tax-deductible pledge or donation. With your help, we can meet those goals and continue to make a difference.